I want to begin by giving thanks, Madam Speaker, and particularly on my committee. I want to thank the staff that has worked so terribly hard, Michelle Varnahagen, Megan O'Reilly, Jody Calamine, Aaron Albright, Meredith Regine, Rachel Rackerson, who have all supported this tremendous team, and the professional staff of the Committees on Ways and Means and Energy and Commerce, and certainly to my colleagues, Chairman Rangel and Chairman Waxman, to our subcommittees chairs, Mr. Andrews, Mr. Pallone, and Mr. Stark. It has truly been an honor to be involved in this debate and to sit in the same room with the Dean of our House, John Dingell, and to be able to craft this legislation. It's an honor I will remember the rest of my life, and I thank the Democratic leadership for giving us the space to bring President Obama's bill to this House so that we can pass it and we can change America. And I certainly want to thank Speaker Pelosi. Without her leadership, her tenacity, her passion, we would simply not be here today. We're about to make history. And the reason we're about to make history is because many of us have so much confidence in the very great things that America is capable of achieving. America has been challenged throughout its history to achieve great things. On behalf of Americans, on behalf of the world community, we have risen to that challenge. But throughout that history, one challenge has eluded us. The challenge to come and to finally provide access to affordable health care for all of our citizens, for all Americans, to provide them the kind of security that they would know with this legislation, to provide them the understanding that never again will they live in fear that they will be without health care for whatever circumstances take place in their lives. And every member on this chamber, on both sides of the aisle, have encountered our constituents over our public careers as they've told us these terrible stories, dramatic stories, painful stories, sad stories about how their family has been crushed, or their friends or their neighbors, people they care about, that they work with, by circumstances beyond their control. How when one circumstance leads to another. How in America today, when the layoff notice comes, you are also on notice that you will lose your insurance. Your world is turned upside down immediately. You struggle to find employment or retraining. You struggle to refigure your family's finances, and you know that if your children are sick, they won't be able to go to the doctor. You won't be able to afford it. If your spouse is in the middle of treatment, that treatment can be curtailed no matter what the illness, no matter how serious it is, no matter how important the treatment is. It can go in a flash. We cannot continue to ask American families to continue to live on that edge of uncertainty, of insecurity, of the possibility of fiscal ruin. A small event, because of the lack of health care, can explode into the life of a family, into the life of a community, when it happens over and over and over again. But this legislation says that's not going to happen again in our future. We're going to become the architects and the builders of a system that will provide care to these people, will provide services to these people, will provide security for these people, so that these American families can go to work with confidence, they can buy a home with confidence, they can think about their kids' education with confidence, and know it will not all be wiped out in a flash because their insurance was canceled. The cap was placed on their out-of-pocket expenses. I thank the gentleman.
Gentleman's recognized for a minute.
That's what this legislation is about. We can talk about all the internal merits and the back and forth and the interesting, but at the end of the day, for the first time in our history, we deliver to all Americans the security that their family will have an opportunity to continue on a stable financial track, and that they can make the kinds of plans that we want to make for our children, our grandchildren, that their neighbors might be able to make. But in America today, because of the absence of this policy, because of the absence of a comprehensive health care bill that provides universal access, because of the failure of a bill that will help families that are struggling to meet the demand, to pay the premiums, because of that failure, as the Wall Street Journal said, we pay a huge price in innovation because people know they'll be penalized if they start a new business, if they take an idea and try to take it to fruition, if they switch jobs for a better opportunity, maybe career-wise, but doesn't have insurance, if they want to go to work for a startup where they can't provide
time
it.
has expired.
Let's give America, for the first time,
The
health
gentleman's time has
security for their
expired.
families, their friends, their kids, and their
Does the gentleman
neighbors.
from New Jersey wish